morning,
Nice to
everyone,
meet
and
you.
welcome to this
Oh, thank you.
morning of wellness, health, and enlightenment. It's wonderful to see that so many of us have gathered here around a topic that touches each and every one of us, our health. Recently, I came across that in the Bhagavad Gita, Bhagwan Krishna speaks about sattvic foods, foods that nourish, that energize, and that support well-being. Thousands of years later, modern science still continues to explore a very similar question. How does what we eat influence how we feel, how we live, and also even how we heal?
Namaste everyone, good afternoon, good morning once again. I think we're all in for a special treat. Whenever I've had the opportunity to come to a World Vegan Vision event, I've learned a lot. I've incorporated the learnings into my lifestyle and seen immediate impact. So I think I'm looking forward to a very informative session today as well. So without further ado, I would like to invite Ms. Suman Munjal, President of World Vegan Vision, New York chapter. Thank you.
You didn't introduce yourself, both of you.
My name is Rahul Bhargav, and this is my wife.
Namaste, I'm Richa.
Hello everybody, I hope everybody is feeling okay. The AC will be on. I mean, it's on now, but it will take a few minutes to get cold. Namaste and good afternoon to each and every one of you. As President of World Vegan Vision, New York chapter, it is my heartfelt privilege and honor to welcome you all to today's program, Dietary Research in Cancer, Food for Thought. Looking around this room, I'm truly moved. You are here because you care about your health, about your families, and about making choices that matter. That means a lot for us. Cancer is rarely just one person's journey. It ripples through families, through friendships, through entire communities. That's exactly why conversations like today are so powerful. They bring us knowledge when we need clarity, hope when we need strength, and practical tools we can carry home and actually use. We are deeply honored to have with us today Dr. Urvi Shah from Memorial Kettering Cancer Center, a researcher whose work sits at the meaningful intersection of nutrition and cancer care. We are equally delighted to welcome Shalu Nijwan, founder of Plainview and a Sharon certified holistic nutrition and health coach, who will show us that healthy plant-based eating can be joyful, accessible, and delicious. And we are especially grateful to Dr. Nori. Who doesn't know Dr. Nori? I hope he comes soon because he said he will be attending today. Dr. Nori is someone whose lifelong dedication to cancer care and prevention has been an inspiration to so many in this community and beyond. He has been granted first Padma Shri and then recently Padma Bhushan Award from the Government of India. These are the third and fourth highest civilian award bestowed by the Government of India. Now we see this beautiful temple. It belongs to Dr. Nori, and I'm so grateful that he is letting us use it. A warm and sincere thank you to our wonderful volunteers, our generous supporters, past presidents, community leaders, and our tireless organizing team. Please stand up and be recognized. This afternoon would not be possible without you. We hope you leave today feeling informed, encouraged, and perhaps a little excited to try something new at your dinner table. And now it is my pleasure to invite Dr. Rajesh Kakani to formally introduce our first distinguished speaker, Dr. Urvi Shah. Thank you all. And once again, welcome to everybody.
Thank you so much. It's such an honor to introduce Dr. Urvi Shah. So her resume is only 55 pages, so there will be no lunch, it will be a dinner. Okay, okay, but it gives me a real pleasure to introduce her. And let me just start from here, okay? So this is MD, of course you know, but this is a separate Master of Science, and she's a diplomat of the American Board of Lifestyle Medicine. Okay, so let me just quickly talk about lifestyle medicine before I come to Dr. Shah. You know, we all know about healthy lifestyle, but now our medical complex has a name for it. It's called lifestyle medicine. There's a specialty, and Dr. Shah is one of the few who's board certified in lifestyle medicines. So she's going to talk about nutrition, but there are a total of 6 pillars of lifestyle medicine: whole food, plant-based nutrition, physical activity / exercise, restorative sleep, stress prevention / management, and the most important is positive social connection. So please keep your friends and family. And then, of course, avoidance of risky substances. I add my 7th one to it, which is, you know, don't make yourself prone to accidents. So, you know, wear a seat belt, don't drive at night, you know, wear a reflective clothing when you're walking. So, Dr. Shah, she's a physician scientist at Memorial Sloan Kettering. She is a graduate of the prestigious Grant Medical College in Mumbai, residency at Tufts, then fellowship at Montefiore, and then she has done groundbreaking research which explored the exciting frontiers of nutrition and medicine, how nutrition can delay the onset of cancer, okay? She developed the first pilot nutrition trial using whole food plant-based diet for patients with, you know, sort of who were at the doorstep of cancer and how to delay the manifestation of their cancer. She has earned numerous awards. I'm not going to bore you with that. You know, top 40 under 40 for cancer, blah, blah, blah. So I'm not going to do all that. Okay, all that is available, but it gives me a real pleasure to, you know, connect World Vegan Vision with, you know, a leading, I'm going to call her Western science researcher, who's been able to convince the Western science about the benefits of plant-based nutrition in a scientific method. In her fun time, of course, guess what she does? She likes to run and hike. So that's the other part of lifestyle nutrition. So thank you so much for allowing me to do this. Thank you, Rakesh. Thank you, Mr. Gulgal. And of course, we have among us another professor of lifestyle medicine and an oncologist, Dr. Tarun Basu. Thank you.
Good morning, everyone, and thank you so much for coming to this talk on a Sunday and taking time off from relaxing at home. So, did all of you watch the Knicks game yesterday, or some of you? Yeah. Did you know that there are some top athletes who are plant-based? Did you know that Chris Paul is vegan since 2019 because it helped with his inflammation and helped with improving performance? So this is not something like fringe anymore. Mainstream athletes are also thinking about this to improve outcomes and do better in performing. There's a good documentary called Game Changers that I think he's featured in it too, and you can get some inspiration and information from there. So I'll start with just talking about, these are my disclosures, and this is the patient perspective. So while I've been doing this research, a patient who I don't know reached out to me on social media and said, thank you for doing this research, but my oncologist told me just keep eating a balanced diet. And at that time, it got me thinking about other studies. And so I had posted on social media saying, like, you know, there are very, very few patients who eat well-balanced diets. An oncologist pushed back and said to me, we shouldn't be telling them anything more than just eat a healthy, well-balanced diet. So now I'm seeing like these diametrically opposite messages, and I'm thinking, what is a well-balanced diet and how many people really know what that is and how many actually follow it? When you look at the general US population, less than 5% of the population meets dietary fiber guidance, and only 10 to 12% actually get fruit and vegetable intake as well. That is recommended by the USDA guidelines. So we're not even talking about plant-based eating, just general guidelines. If you talk about that, less than 5% meet those guidelines. So that got me thinking, what food or supplements can I take? I find that this is one of the most likely asked questions by patients and also the least likely answered by oncologists. And so I think that dietary research and nutrition to support cancer patients is really an unmet need and something that we should be thinking about. I got into this research somewhat with my own personal experience about 10 years ago when I was in training at Montefiore. At the end of the first year in my oncology training, I got diagnosed with lymphoma and I needed chemotherapy for 4 months. And that experience got me thinking about what are factors really that are in our control and what's modifiable. And what I realized is that as doctors and oncologists, we don't really focus enough on that and get training in that. So then we're not really talking about it enough to our patients. So that's what got me thinking about wanting to do this research. Never thought I could make a full career studying it. But what I realized was that once we started doing one study, we got going, and then now we have 6 studies going in this space. And once all our studies are enrolled, we'll have over 600 patients participating in our studies. So just as an example, this is a case of a patient that I saw many years ago. Now, this patient had many medical problems, and you may say to me, diet won't directly affect cancer. I don't know if it's going to make a difference. But you can all agree with me that when a patient has so many medical problems, I am not able to give them all the best therapies there are, right? So indirectly, you can agree that diet affects cancer risk. And so this patient was not a candidate for transplant, CAR T-cell therapy, many clinical trials. So the patient lived a shorter life because of having so many other medical issues. So even if diet and lifestyle do not directly affect cancer, if we are in the best shape possible when we do get a diagnosis like that, then we can really tackle it better and be able to get all the treatments that are available for us. And then on the other side, you know, cancer does increase risk of cardiovascular disease and other aspects too. So this is another patient I had seen many years ago. And you can see that this patient actually doesn't have much medical problems, like actually a very short list of problems. So you'd say this person's relatively healthy, everything's good. But and the patient went into a complete remission, meaning they actually responded to their treatment, but unfortunately died of a cardiac arrest while in remission. So we also have to realize that patients who've had treatment and chemotherapy and some of these things are at higher risk for cardiovascular disease, heart attacks, strokes, all of those things. So if we can really help patients live healthier after, that could potentially also help them live longer indirectly. I'm going to talk about risk factors for cancer, thinking about a few of the main aspects, but these are things that also, you know, not just with cancer, but other aspects too in life in general could be associated. So how many of you have heard about obesity being associated with risk of cancer? Few people. Okay, how many have heard about diabetes being associated with cancer? Similarly, few. So you can see here, this is a figure showing 13 cancers clearly associated with sufficient evidence for obesity linking cancer. And I treat multiple myeloma, which is a blood cancer, and that is one of those 13 cancers in this field. So, you know, that's a place that we can study and intervene. We published one study basically doing like we just wanted to calculate if we had no obesity in the world, how much less myeloma would we have, or one type of blood cancer. So hypothetically, like if we just did a math problem and said there was no obesity, how much less myeloma, and if there is obesity, how much myeloma, we were able to see that about 11 to 17% of myeloma cases possibly would be reduced just without obesity. So 1 in 5 to 1 in 10 of that cancer could be avoided or reduced just with no obesity being present. And we see that there are multiple mechanisms through which things like obesity can affect risk of cancer. So it's not just the fat cells, but also there are hormones, inflammation, all of those aspects together that drive cancer or increase risk for it. Another aspect is diabetes, and fewer people know the link between diabetes and cancer. The link is strongest for which cancer? That's right, it's pancreatic. And the link for obesity is strongest for which cancer? Which one? Breast. Similar? No. Endometrial cancer. So the strongest link for obesity and endometrial, meaning the uterine cancer, so in the uterus, that strongest link is obesity there. And for diabetes, the strongest link is pancreatic cancer. But that doesn't mean there's not a link with other cancers too. So you may say, what's causing the cancer? Is it a cause or is it correlation? So you could say, oh, the person's has bad genes or a bad diet, and so the same things that are causing their diabetes are also causing their cancer. So this is what we would call a correlation, meaning that the person is at increased risk for diabetes because of their lifestyle and their genes, and those same things are causing their cancer too. So it's not associated or not causing it, but it's just that the person has both together. And then you could say the other thing is, you could say that the person has a bad diet, develops diabetes. The diabetes leads to high sugar, high insulin levels, and those sugar and insulin could be what's driving cancer. So now that's a causation, meaning that the sugar and the diabetes is causing the cancer. I think it's somewhere in the middle. There's going to be some association and there's going to be some direct causation too. So this study, when you look at these curves, what you're seeing is okay, this is not working, but you can see the blue line, which is basically the high dose, and the dark blue line is the low dose. So what we see is that even in type 1 diabetics, just the dose of insulin can affect cancer risk. So even if somebody has type 1 diabetes and they say, I don't have a choice, like I'm going to need to take insulin, and you have diabetes, like you can't reverse it, you can still affect outcomes by lowering dose of the insulin that you need. So you can see here that in the light blue, there's less cancer in people who have lower doses of insulin compared to those who need higher doses. So it's possible just with dose of insulin too that there's risk of cancer changes. And what we see is that patients who have diabetes and cancer actually have worse survival as well. So they don't do as well when they do get cancer. And lastly, in this figure, what at the bottom you can see is that some colleagues at Mount Sinai who I worked with looked at mice with diabetes and cancer, and they showed that the mice who had diabetes and cancer actually had the cancer growing much faster than the mice who did not have diabetes and just had the cancer. You can also see here that these factors can affect survival. So diabetes and cancer linked to worse survival in all of these figures with different cancers. Now moving on to the diet part or thinking about it, first thing we did was like survey patients and say, how many have questions about this? Is this something that's like commonly asked? And what you see is majority had questions. Majority said their oncologist did not address it. And majority said that if their oncologist gave recommendations, they attempted to follow these. So patients want to know. And what was most surprising to me was that patients after a diagnosis that's as serious as cancer are making changes on their own, whether we like it or not. So patients' diets got healthier once they were diagnosed because they, felt like maybe that could help them. So it would be good for, doctors to be talking about this more. So question for you all, do we have more human cells or more bacterial cells in our body?
It's not a fair question.
Because it's a trick question, because it's a...
2 years ago we had a Dr. Muta from, and that's what...
Oh yeah, we told you. So you all know the answer. So we have more bacterial cells, but we only see our human cells. How is that? Like we're not seeing these bacterial cells. So we are about 30 trillion human cells and 38 trillion bacterial cells. The problem is that our bacterial cells are so tiny compared to the human cells that you don't see them, but they're all around us, inside of us, in our gut, and they are there. So when we are made more of the microbiome than human cells, shouldn't we be thinking about what does the microbiome want to eat and like to eat? And I think that that's something that we have to think more about, like what is food for the microbiome? That's right. So here's a figure which shows you the lining of the gut. So this is basically your gut lining. And in a normal state, you have, this is the gut. So inside where we, our stomach and the GI tract, and then this is the body inside, the immune system. In a normal state, there's this nice blue mucus layer that keeps a barrier between what we eat and what's in the blood. Like this is called the barrier. And so it prevents inflammation in the immune system, and only the good molecules like the short chain fatty acids go through. But when we have dysbiosis, or the gut is not functioning right, these microbes are not doing well, that blue layer or the mucus layer gets degraded, because if the microbes don't have food to eat, they will start eating the mucus layer basically. And if they're eating the mucus layer, then you don't have this barrier anymore, and everything you eat is going straight to the bloodstream in terms of inflammation and driving that. So,
what does the microbiome eat? I missed it.
Fiber. But if we don't give it fiber, then it will eat mucus. And if it's eating mucus, then that tight junction between the gut and the blood becomes more loose, and all these like inflammatory molecules can go through. So we want to keep that junction tight, and the way to keep it tight is if we can feed fiber, feed the bacteria fiber, they won't eat the mucus. And so you can see that we're just scratching the surface of the microbiome. And what previously was thought, when we think about cancer and the frontiers of how cancer treatments have evolved, in the beginning, what were the kinds of chemotherapy? People would have nausea, vomiting, hair loss. We would call these like cytotoxic chemotherapy, like they kill all the cells, but they kill good cells too, and people have side effects. Then came the next wave of frontier of treatments. These were targeted therapies based on genetic sequencing. Everybody thought, wow, now we'll cure cancer. We have all these genetic mutations. We find a target to it and we can manage it. Some cancers were actually cured, or at least got much significantly survival, but it didn't fix all cancers. Then came the next frontier, that was immune therapies. So you heard about bispecific antibodies, CAR T cell therapies. These are all these immune therapies that are enhancing the immune system's job to fight the cancer. And lastly, the most important next frontier, I think you're going to see, is the microbiome-directed therapies, because the microbiome is so tightly linked to the immune system that if you can see better immune health, you can see better microbiome health, you see better immune health, and that can help immune therapies work better too. So one concept of microbiome health is something called diversity. When you think about diversity, think about a rainforest versus a plantation. When you think about a rainforest, you're thinking about multiple species of birds, plants, insects, fruits, vegetables, like all of these different things are living together in one place. But a plantation, suppose a banana plantation, you're going to see only one species there, and there's not that wide variety. And that difference between the diversity of the microbiome is something that is quite important. So we would like to have a diverse microbiome, because you can see in this figure that the red curve basically shows you people who had the higher diversity in their microbiomes tended to live longer or have better survival after cancer than those without that diversity. So is it possible, and can we improve our gut microbiome diversity? Is this something that's changeable? The nice part about the microbiome is it's modifiable, whereas our genes are fixed, like what you're born with, but the microbiome, there is ability to modulate it, modify it, because it's not fixed in and around us. So one of the biggest drivers of the microbiome is dietary patterns. So if we can change diet, can we change the microbiome? Can you think about how many different plants you eat in a week?
Eat now, or we should?
No, just if you can think about it, if you can guess the number, like what I mean is in the last 7 days, what is the variety of plants you've eaten? So if you eat broccoli 5 times, you count it once. If you eat broccoli, green beans, chickpeas, quinoa, lentils, like all of those, you will count them 5 different.
30?
So you've eaten 30 in the last week? That's the goal, yes. So it's harder to calculate with that. Those are important, but in those 30, they don't include those. So when I've asked patients this, I found like in the group, people actually write down and try to see how many they can remember. And I can barely have 1 or 2 who actually get to 30 in the last week. So majority of people, we are creatures of habit. We don't really go outside our comfort zone. If you like cauliflower, you'll be eating cauliflower all the time or whatever that food is. So this study is showing you that people who eat more than 30 plant foods actually have better short chain fatty acid producing bacteria. So these are bacteria that make these molecules that affect the immune system positively. So things like short chain fatty acids are made by the bacteria, and butyrate is one of those. And we all want more butyrate because butyrate has anti-cancer, anti-inflammatory effects. What they showed in the study is that people who ate more plant foods, like a variety of foods, tended to have more of these bacteria that are good and less antibiotic resistance in their gut as well. So that's also good compared to those who ate less than 10 plants per week. So trying to aim for that is one nice way to go out of your comfort zone. And what you can also see is that like you could make a soup with multiple different vegetables and plants, and that could in itself in one meal give you about 5 to 6 different plants or more at any given time. Another way to improve diversity is to think about the microbiome and immune system. And so this study gave patients who were 18 patients, they told them eat 20 grams more of fiber than what you're eating anyways, and let's see what happens to your microbiome. And what they showed was that actually the microbiome function improved. They were able to make more of these short chain fatty acids, the butyrate, just by eating more fiber, because fiber is the food for those microbiome. And then they also asked them to do another experiment where they had them eat 5 to 6 servings of fermented foods a day. So fermented foods could be things like yogurt, kefir, kimchi, sauerkraut. In Indian food also, some of the South Indian foods can be fermented. In teff flour, in injera is fermented. So these different kinds of fermented foods. And those actually improve the diversity. Remember, diversity is good. And also reduced inflammation. So now we're going to talk about a study which was done at the NIH. And what they did in the study was they had patients admitted for 4 weeks. So they said, you cannot leave the room. You're going to be in here. We're going to watch everything you eat and we're going to give you all the food. So now they can really measure everything really tightly and see what happens. They divided them into half of them got a vegan diet and then half got a ketogenic diet. A ketogenic diet is basically a diet that is low in carbohydrates and high in fat. And then they said we are comparing a low fat diet, which is the vegan diet, compared to a low carb diet, which is the ketogenic diet. And what is happening to weight loss? What is happening to their body composition? What's changing here? What they showed was that both groups actually lost weight. But question for you all, and if you've already seen the slide, you may know, but what kind of weight did they lose on the ketogenic diet and what kind of weight did they lose on the vegan diet? We have a very smart group here. So in the ketogenic diet group, there are only, what are things that you could lose weight for? You could lose fat, you could lose water, you could lose muscle. You're not going to lose bone in a few weeks. So you have these 3 things to lose. When you're eating a low fat diet, you're likely to lose fat. When you're eating a low carb diet, you're not losing fat because it's a high fat diet, and you're losing water and muscle. And now in cancer patients, that is a concern if patients are losing muscle as well, because already we know that cancer can cause that inflammation and muscle loss sometimes. So that's really what they showed here. That the no, it's just diet, and it's a short study. So, patients need to be followed longer term to see, but in the short time, they're already showing that you see this fat-free mass change, meaning that's muscle and water. there was much more loss in the ketogenic group compared to the other. Then they also looked at the immune system, and they showed that in the short period, the immune system is also changing with just these dietary changes. And a ketogenic diet led to some different kinds of immune changes versus the vegan diet, which led to more antiviral immunity. So infections and things could be better as well. So thinking about, can diet affect risk of infection? Like what you eat, can it affect how likely you are to get infection? So there is COVID was a good time to study this because it's one infection we're looking at, and so it's possible to see like what the risk is. So in this study, they took healthcare workers and they said, what is your dietary pattern, and then who gets more COVID, and they followed them. Interestingly, the people who ate more plant-based diets had 73% lower odds of moderate to severe COVID compared to those who were eating low-carb, high-protein diets. And if one study wasn't enough, here's another study that's basically showing the same thing, that those who ate more plant-based diets actually had less COVID. So these are the World Cancer Research Fund guidelines. How many of you have heard of them? Very few. So this is guidelines basically on cancer prevention and how do we reduce risk of cancer. Even in our survey for cancer patients, very few know about it, and only a third of patients actually knew about these. But what you can see out of these 10 recommendations, 6 out of the 10 are really around diet. And they talk about a diet that's rich in whole grains, fruits, vegetables, beans, seeds, as well as reducing red and processed meats, sugary drinks, alcohol, and fast foods as well. Now, most dietary studies have looked at cancer risk in a population way. So what they do is they survey thousands of individuals, ask them to fill out a dietary survey and say, what is your diet pattern like? And then you follow them for decades over time, and you say, who develops cancer over time? What you can see is that these are 3 studies from 3 different countries, but they're showing pretty much the same consistent thing, that people who eat more plant foods had a 15 to 20% lower risk of cancer. Whether you break it down into vegans, vegetarians, meat eaters, or you say seafood eaters, non-vegetarians, or you say high plant-based diet index score. So even if somebody is an omnivore, but they're eating more plant foods than they're eating meat, then that would be a higher score. So you can see about a 15 to 20% reduction in risk of cancer. So this is interesting, but what was surprising to me that despite this information, when I was looking at the trials that are currently ongoing on the website, I found that there are very few studies in cancer patients actually looking at plant-based diets. Most of these studies are actually looking at ketogenic diets. But the population studies are showing you that the plant-based diets reduce cancer risk. So why aren't we studying them in cancer patients to understand how they help better? And so that to me was a very surprising thing to see, that what we're seeing in observation, we're not studying in intervention as oncologists. And so we published this paper looking at what are the mechanisms around ketogenic diet and plant-based diet and how do they affect cancer risk. And you can see that any diet that avoids refined carbohydrates is going to lead to some weight loss. So both these diets will lead to weight loss, and through weight loss, inflammation can improve, some of those things. The difference is that the plant-based diet is rich in fiber. Fiber feeds the microbiome butyrate and things that we talked about, and those things help also with reduction in cancer risk. When we talk about a ketogenic diet, many people think they're doing ketogenic diet, but in reality, they're really doing low carbohydrate diets. To reach ketogenic diets and achieve that state of ketosis, you need to be extremely, extremely low carbohydrate, and then only these ketone bodies that you see in blue there form. What these ketone bodies do is they have anti-cancer, anti-inflammatory effects, but you have to eat such low carbohydrates to let those ketone bodies form that it's very hard for most people to sustain long term. So people aren't really getting that benefit from it. And the other issue is, like I showed you, the body composition, so the muscle loss. And the other last thing is that because it's a high-fat diet, there's higher risk of cardiovascular disease, so heart attacks, strokes, all of those things. So long-term, I would not recommend a ketogenic diet to people because they are losing one main nutrient in their diet, which is dietary fiber and the low-fat aspects too. And then you heard of people saying, oh, let's think about fasting mimicking diets, like intermittent fasting, and how does those help? So they also reduce this insulin-like growth factor and these molecules that increase cancer risk, but also increase ketone bodies, the same thing as a ketogenic diet could do, as well as reduce inflammation. So it is possible to get some of those benefits through time-restricted eating or eating through a certain window or a period of time instead of just eating all round the clock, because now we have access to food 24/7. So we eat late at night, we wake up early and eat, but it's nice to be more regimented and eat within a certain time window and have a little time for the gut to rest as well. There's a study going on in cancer patients looking at ketone bodies, supplements, and seeing if that can enhance response to CAR T-cell therapies or immune therapies. We don't have results yet, and so it's something that we still don't know enough. So when we try to design these studies and think about how do you design studies in diet and cancer, there are lots of things to consider. So here's a summary of all the things we need to think about: the funding, the which patients, which disease, which type of therapy, which biomarkers, how long should we do it, all of those aspects. So we published a paper just looking at all these aspects and how do you think about it. So now I'm going to move on to maybe the more exciting part is like if we actually change people's diet, what happens to their microbiome? What happens to their immune system? Does it change? Because so far I've shown you associations that, you know, healthier diets may be associated with less infection, better microbiome, all of those aspects. So can diet prevent cancer, treat it along with other therapies, or in the survivorship space, patients living longer because of their lifestyle changes? So I'm going to focus some of these trials in the lens of a blood cancer called multiple myeloma. And these pre-cancer states or precursor states, just so you understand, like these are pre-cancer conditions that increase risk of the blood cancer. So I will use the words MGUS and smoldering myeloma for that. And this is the blood cancer multiple myeloma. So when we have these pre-cancer states like MGUS, these studies show you that people who have an elevated BMI, if they have the pre-cancer state, they have double the risk of progression to the blood cancer myeloma. So there's already that increased risk. So we have an opportunity here as oncologists and patients that if we have these increased risks, can we delay progression? And here are some factors that affect risk that we talked about. So is it possible to tilt the scale or delay progression? So this was our study, the Nutrivention trial, where we basically provided patients with 12 weeks of food. We actually shipped them lunch and dinner for 12 weeks. We provided coaching through patients, and then for 24 weeks, we provided coaching and we followed them for 1 year. You can see some of the food that we sent them. And we were looking at, is this feasible? Is it possible? And we never calorie restricted them. We said, you can eat as much as you want, as long as you're focusing on unprocessed plant foods. These were patients only with a BMI over 25 and these pre-cancer states that enrolled on the study. You can see that when we did the study, before they went on the study, at baseline in the gray, that only 20% of their calories were coming from unprocessed plant foods. This is similar to the general US population and most people, that unprocessed plant foods is less than 20% of calories for most people. When they did the study, it went up to 92% during the time we were providing the food, but even 1 year later, it was high at 60%. And then you can see their weight dropped by 7%, their fiber intake increased significantly, their quality of life got better too. Many doctors and patients will say, this is too difficult, you're doing this for the study, but patients are not going to be able to do it. So we asked patients, how difficult was it when we supported you through it? And nobody said it was difficult. So overall, I think that it is possible if we support patients or we get the right help to do it, it's possible to do it. And you can see here that patients actually said that so many different symptoms of theirs improved. So they felt better in terms of energy, sleep, GI symptoms, anxiety, depression. What's more is some patients were able to stop prescription drugs too. So they needed less medications as well. What we saw is that in some patients, this pre-cancer state, there's a protein in the blood we follow to see if it's progressing to the cancer. And we were able to see that that protein actually seemed to have slowed down in some patients, suggesting that maybe this is actually delaying the cancer progression. We also saw insulin levels drop. Remember, we never controlled how many carbohydrates they were eating. We said eat as many as you want, but what they're eating is complex carbohydrates, not refined carbohydrates, right? So that shift in itself led to a drop in insulin levels, as well as cholesterol levels, and this IGF-1, or the molecule that's associated with cancer growth. Now, moving on to microbiome, remember we talked higher diversity is good, but can a diet really change diversity? What you're seeing here is that the diversity increased, but what's more, it increased even more and maintained 1 year later. So as patients are eating more diverse diets with more types of plant food, you're seeing that benefit. The butyrate producers, so butyrate as well increased. And this correlates very significantly with how much fiber they're taking in. So if they eat more fiber, their microbiome is healthier, and we see that here. Another part is looking at the immune system. So does this change the immune system as well? C-reactive protein, how many people have heard of that? So it's a marker of inflammation, and higher levels means that a person has systemic inflammation. So we'd like to see that level come down. We don't want inflammation generally. And so you can see that just with changing the diet, their inflammation markers dropped. The neutrophil count, which is also a sign of inflammation, that reduced too. And when we looked, so just look at the figure on the right, and just all these lines are basically the cells talking to each other. So in this blue circle, you can see a group of cells, and they are basically talking to each other, and the gray lines tell you how they're talking at baseline. So at baseline, all these cells are converging on the exhausted cells. So they're really talking, but they're talking with the exhausted immune cells. 1 year later, you can see where the green lines are now converging. They're all converging on the cytotoxic T cells and the natural killer cells, telling you that there's a shift in how the immune system functions. This is one patient on the study before going on the dietary changes and after. This patient was able to stop insulin after 30 years of being on it, and felt much better, a lot of benefits, and felt like he felt much younger and healthier after doing this. We had some colleagues in Italy try to understand mechanisms and do these similar studies in mice. And what they showed is if they gave mice with this pre-cancer state, half of them a standard mouse diet, and the other half they gave them a high-fiber mouse diet. This was not a Western diet, no high-fat diet, just standard mouse diet versus a high-fiber mouse diet. What did they see is that half the mice in the high-fiber diet group, the green line, never progressed to cancer. All the mice in the standard diet had progressed to cancer.
How do you determine the pre-diabetic stage of mice?
Not pre-cancer stage, but these are mice that are given smoldering myeloma, like they're injected. So it's a mouse model of a pre-cancer. They wait until the mouse develops the smoldering myeloma, and then they randomize them to either the diet with a high-fiber diet or a standard diet. And then they watch the blood markers to see when it progresses to myeloma. Yes, the myeloma. Yeah. And you can see that there is some difference in the weight. And a lot of people say it doesn't matter what you eat, as long as you just maintain normal weight, that's fine. Like as long as somebody has normal weight, it doesn't matter what they eat. So we want to show you some data on why what we eat and diet quality also matters, not just how much we eat and quantity. So what you can see here on the right side is the weight of these mice. So the mice who got the high fiber diet actually had lower weight than the mice who had the standard diet. So what we did is, you can see that the number of calories the mice who are eating the standard diet have much higher calories they're taking in compared to the mice who are eating the high fiber diet. So there are less calories when they're eating a high fiber diet. And that's the thing about fiber rich foods, they're lower in calories, so they automatically lead to you eating less. But now we want to understand, is this the effect of just the less calories, or is it really the effect of the fiber? So they did an experiment where the mice were given a control diet which has no fiber but the same number of calories. So now what we are studying is not the effect of how many calories, but effect of fiber versus no fiber. And we did the same experiment, and you can see that the mice who got the high fiber diet had lower weight, had lower fat, had longer colon length, means better microbiome, and delay in appearance of the cancer. So what this tells us is that it's not just about calorie restriction or eating less, but it's about what we eat and how we eat too, and fiber-rich foods are important. So we are enrolling on some of these studies similar to that are looking at high fiber diets in these pre-cancer states currently. We don't have results yet, but these are studies that are ongoing. And then we have one more study in a pre-leukemia state that we are enrolling to. So, if ever patients interested in these, they can reach out if they want to enroll. Now we talked about in the cancer prevention space how diet could change all of these things and maybe delay progression to cancer for some patients. But what about with treatment? Is it possible that during treatment, if we change diet, we can enhance response to some treatments or patients live longer because of that? So remember again, butyrate, the molecule we've talked a lot about. Hopefully you all remember it even after this talk. But butyrate is a molecule that when a person's diagnosed with cancer, it seems to have lower levels than when they had pre-cancer. So as we get more, aggressive disease or cancer, those levels seem to be lower in the patient. But what's interesting is that the patients who actually responded to treatment, so, the CRMM is basically the myeloma patients who responded, their levels were much higher of butyrate than the patients who were newly diagnosed with cancer, showing you that the butyrate levels can be associated with risk. So we are doing this study in newly diagnosed myeloma patients. So when they're just diagnosed with cancer, is it possible that if we provide them with food and guidance, can we help them actually have better response to treatment, better quality of life, and do better on treatment? Now we're going to talk about a skin cancer, melanoma. Remember, myeloma was a blood cancer, melanoma, skin cancer. Melanoma is treated with an immune therapy called checkpoint inhibitor. What studies have shown is that when you take this immune therapy, if you have a healthy microbiome, meaning you're eating enough dietary fiber, you actually respond better to the treatment and you live longer. So you can see that red line, those are people who ate enough fiber. The ones who did not eat enough fiber actually didn't live as long. And you can see that it's not one study, 2 studies are showing the same thing, that eating more plant foods, better survival. And then when we think about cancer survivors, and can diet and lifestyle help patients live longer and better when they have it? So I'll show you one study we did. This was an observational study, meaning we just monitored patients over time. And we said, let's look at what features are associated with them responding better to treatment. And what you can see is that, the turquoise color, which is saying yes, those are the patients who had a complete response to cancer treatment. The purple are the ones who did not have a complete response. And you can see higher diversity, higher butyrate producers, higher butyrate levels in those who are responding to the treatment. And the diet, healthier diets were also correlated with that, telling you that just dietary patterns may affect the microbiome, affect the immune system, and lead to better response to treatment as well. So I think that dietary effects can be multiple. We talked about weight, we talked about insulin resistance, we talked about the microbiome, We talked about the immune system, and then also the effects on cancer. So I joke, but I think this may be true, and maybe you all agree with me now that dietary fiber may just be the original immunotherapy that we haven't thought about. So now it's time for some trivia and get you guys' opinion on this. So how much do Americans eat on average for added sugar? I'm asking in teaspoons. Can somebody guess how many teaspoons on average do we take in the US? This is average every day. 10? 10. 22. So we have 10, we have 22, 15. Who said 15? 15 of you. So you all are the closest. We are actually at 17. This is where the average is. And if you ask people, they will all say, oh, we don't eat much sugar because it's all hidden sugar. You don't even know you're having the sugar. Like it's in the cereal, it's in the cookies, in the cakes, in the mithai, all of those things where the sugar is and you don't realize you're having it. But how much should we have? Ideally, that's 0. But if we say, that's great. So less than 6 or 9 teaspoons per day.
I have one question. Who do you consider Americans? People of all races?
The US population. So this is the whole US population. So you can see that 1 can of Coke has basically 10 teaspoons of sugar. So if somebody's had 1 can and 1 cupcake, they've already reached that number already, right? So it's something to just keep in mind when you are. One thing to remember is when you look at labels, about 3.5 to 4 grams of added sugar is 1 teaspoon. So if you see on a label it says 12 grams added sugar, you know you're having 3 teaspoons right there. Okay, how about dietary fiber? We kind of talked about it, but not the number. So you have to tell me in grams per day. How many grams per day do Americans take? 10. That's close, very close, which is about 10 to 15. How many should we get? Well done. So that's about 30. So we're basically at half. And like I told you before, that the US population, or generally we get half of what we need, and we want to actually get, and less than 5% get how much we need. So 95% of the population is less than what we need. So it's likely that most of us are also in that situation unless we are actually actively thinking about this and planning our meals. What about salt? So 4,000 is close, like they have about 3,400, but we want to keep it to less than 2,300. So you can also see that most of the salt is not the table salt that we are adding, but it's the prepared foods that we buy in the grocery store. We don't even realize that they have a lot of, or eating out. What about fruits? In cups per day, how many cups of fruit do people eat on average? 5 cups? 10 cups? 1 cup? A little less than that, 0.9 cups. And how much should we eat? About at least 2, right? So and one serving of fruit, like a banana, would be 1 cup. What about vegetables? How many cups a day?
3 to 5.
That's 3 to 5 is what's recommended, right? How much do you think people are eating?
Less than a cup.
1.4 cups. And we should be getting double that, so like thinking about at least that. And the last one, protein. How much protein do Americans get? Number in grams per day? Well done. I think this crowd is very smart. So 80 to 100 grams per day is what people are eating. What should we get? Yeah, so the range is 0.8 to 1.2. Some of the newer data says maybe a little higher, like 1 to 1.2. But even if we are to get 1 to 1.2 and somebody is 60 kilos, then they need 60 to 72 grams of protein, right? But what we're eating is actually double that, but we're still so worried about protein that you see protein-rich foods everywhere, advertisements for protein. So I think when you go out and you're thinking about food, instead of looking at how much protein it has, think about how much fiber you're getting, because that's where you're probably missing out and what you want to make a difference. So here's an example of a high fiber diet and Western diet versus a high fiber diet. This is how most people in the US eat, and I've been generous and given them one bag of broccoli on the Western diet side, but that is also more than I think what most would eat. And you can see that they're not meeting the fiber intake requirements at all, because they're really, none of those animal foods or processed foods have fiber in them. Let's now you might all ask me and say, yes, this is good, they're getting fiber, but I'm sure that they're not getting enough protein. What about protein? So are you worried about the high fiber group not getting enough protein? Yes. Not when you eat a fruit, because it comes with fiber. But when you're having a fruit juice, that is very different, and the fiber is taken out, so that is sugar. So orange juice, not so great. Oranges, great, you can eat them. So this is the same example now with protein. And you can see that the high fiber group is also meeting their protein requirement, because every food has protein, fat, and carbohydrates. And you can see that even something like oatmeal will give you 6 grams of protein in 1 cup of it. So these are just some practical tips to consider when you're thinking about diet. I think we want whole grains, unrefined grains. We want fiber-rich foods, plant protein over animal protein sources as much as we can, and then thinking about unsaturated fats as well. What you can see is that many people will say, oh, I don't have time to go and get fresh fruits and vegetables. I work long hours. I live in a food desert. There are all these reasons why it's not possible. But what I will say is, whether it's fresh fruit or frozen fruit, it's the same, and frozen may be better, if not worse, because it's picked right when it's fresh. All the vitamins and nutrients are in it. So you can buy bags of frozen fruit and vegetables, stock your freezer, and you always have some. You can also buy cans of beans that are in your pantry, and you don't need to worry about, like, okay, do I need to cook the beans or have that? It's always going to be there. And then you can also have whole grains in your pantry as well. So you don't need to go to the grocery store every day or every few days. You can go every 2 weeks and you can still do this. That's what I do. I do every 2 weeks shopping. I don't have time to go more often than that.
The canned food will have all the sodium and everything.
No, but you can buy like beans where they are lower in sodium, and you can also, when you rinse them, half the sodium content comes out. So you should wash them before you cook them. Like just put them in a strainer and let water drain through them, like with an open tap.
What about the nanoplastic? Because
The microplastics.
and the frozen food,
So I think that is something that we cannot fully avoid, because even fresh foods, if they're like fish or things, there's going to be microplastic from the ocean. But what we know is some studies show that actually fiber can reduce absorption of microplastics. So it might be something that could reduce microplastic exposure. And yes, if you can buy foods that are fresh, like without plastic wraps and stuff, that would be great. But yeah, if you see most grocery stores, everything is covered in plastic, whether it's a plant food, animal food, whatever it is. So that's the issue. And now the last slide, we're going to just look at a nutrition label together. So when you do buy things, ideally you want to buy fruits and vegetables that don't have a label, because they're unprocessed, right? Like you don't need a label. If it's a cauliflower, it's not going to have a label on it. But if you are going to buy something that is with a label or in a package, how are you going to think about it? So one thing about carbohydrates is that you can see that they talk about total carbohydrates and then they talk about total sugars. You want that ratio to be at least 10 to 1. If you can have 5 to 1, 3 to 1, that's always better. But at least 10 to 1 is something you want to think about. And you want to make sure the total sugars, which are the added sugars, are less than your 6 to 9 teaspoons per day. So when it's 18 grams of added sugar, and if you divide by 4, that's about 4 teaspoons, 4.5 teaspoons of added sugar in that one serving of these toast honey pecans. So while you might think pecans, oh, that's a healthy food, it's nuts, but it's got so much sugar, it's got more sugar than nuts probably in it. So you want to think about those aspects. And you can see the same thing with pecans on the other side. There's no added sugar and there's more dietary fiber. And that ratio is 19 is to 1. So the carbohydrate to fiber ratio is almost 19 times. Whereas there it's like 4 to 3. And the ratio is like less than even 1 point something. So when you think about whole grains, like if you think about white rice, the ratio will be about 20 or 15. When you think about buckwheat, quinoa, those ratios will be closer to 10 when they are whole grains. So as much as you can buy whole grains, that's always better. I know many like white rice. I think, okay, sometimes when you go to a restaurant or things, but if you can buy brown rice or black rice or red rice, that's going to be better because it will have more fiber too. So thank you for listening. And this research, of course, is not something I do alone, but takes a village. I have a strong team, the patients who take part, as well as the funding sources. And thank you for listening.
We have some Q&A.
Sure, happy to take questions.
And then can we recognize Dr. Lori before you?
Oh, yes, yes.
Okay, so we have, I'm going to have everybody do Q&A. So Riyansh, you can go ahead and give mic. Those who raise their hand, keep your questions very brief and just a question because we have limited time. Okay, Riyansh.
Urvi, thank you very much. Have you heard of the neurofiber? That's the bar from the Have you heard of the neurofiber bar? It has 18 grams of fiber, excellent tasting.
Neurofiber.
Neurofiber.
I've not heard of that. So there is one thing to remember is that many things will have added fiber. It's very different than natural fiber. So many times we'll go and say, oh, we'll buy the cereal because it says added fiber, added this. But that is very different. What we want is a diversity of fibers that feed different microbes. So when you say like, oh, it's added with inulin or it's added with one, then that is not the variety of fibers. But when you eat foods that are rich, you have pectin, you have inulin, you have cellulose, you have all these other fibers that come together and feed different microbes.
That's what this is. I share it.
Sounds good.
What about fasting or fasting mimicking diets?
So I briefly mentioned that, and I think that like when I talked about intermittent fasting, it kind of goes with the same. There have been no studies comparing a fasting mimicking diet, which is compared to a plant-based diet, like head to head to say which one is better. But remember, in the fasting mimicking diet, what that is 5 days where they do very low calories, like something like 500 calories. And in that, it's mainly just plant-based diet for 5 days. And then the rest of the month, they say, oh, you can eat whatever you want. And then that basically, those 5 days enhances the immune system and reduces inflammation, the metabolism, and kickstarts it. So I think a plant-based diet, as I showed you, is doing all of those same things. Maybe if somebody adds both together and says, I'm going to do a plant-based diet, but 5 days a week, 5 days a month, I might do a fasting mimicking diet, it could maybe add some more benefit, but there hasn't been a study looking at that. I think time restricted eating is important for all of us as 24. If we eat 24/7, we're not giving the gut time, and eating at specific times is good because otherwise your body holds on to more food because it doesn't know when the food's coming. So regular timings and eating within a window so you can give your gut some time to it.
Is dairy included in the plant-based?
So dairy is not a plant-based food. It comes from animal sources. So many people assume like, okay, if I'm vegetarian, I'm on a plant-based diet. But remember that when we talk about a plant-based diet, the majority of calories are coming from unprocessed plant foods. So if somebody is vegetarian and most of their calories are coming from dairy, eggs, and processed foods, they're not on a plant-based diet. They are actually on a processed diet that's an animal-based diet because those are animal-based foods and those foods don't have fiber. Dairy can have some benefits when it's fermented, but I think, and that data is a bit Mixed, but more for the fermented side. For the non-fermented, I think the data is more mixed because it can have growth hormones and all of those other aspects.
The way we make it at home?
Yeah, that can. Yes.
Okay,
Sorry.
thank you for providing us some details of the study that you have undertaken.
Thank you.
As I understand, most of the study has been conducted with pre-cancerous stages or early cancer stages, which gives us some indication the impact, the positive impact a vegetarian or a plant-rich or a fiber-rich diet has. Have any studies been conducted when the cancer is in very aggressive form, stage 3, 4, or a metastasized cancer, which shows some reversal of that? Have you got any studies
Yes,
like
so
that?
there is one study which was done in metastatic breast cancer, so stage 4 breast cancer, where they gave the patients a plant-based diet and followed them. And those patients also saw benefits on all these markers of inflammation, the immune system, and all of those aspects. So it is possible. The issue is we have to balance it and individualize it to patients. So if a patient is not eating, having significant side effects to treatment, at that time trying to get them to make all the changes at once may be too much and overwhelming. But at the same time, there can be benefits if somebody is got time and able to do that. Also, if a cancer is so aggressive that somebody is going to, it's a few days before the person passes or a few weeks, that may be too short a time to see the full benefit. But I think that there are studies looking at more advanced stages too.
Hi, thank you very much. From what I understand is that white rice versus flour chapati, chapati is better. That's what I assume, right?
If the chapati is made from whole grain or whole wheat, many times it's also made from refined wheat, and then that would not be, that's a refined grain then. So you want to be thinking about really whole grains that are used to make the breads and the chapatis, rotis, all of those things.
Yeah. My another question is the Chinese people eat white rice all day long. They don't have any cancer.
So white rice, when you put it in a refrigerator overnight, for example, and eat it the next day, the starches become more resistant and it is slower to digest. So the glycemic index for pasta or rice, if you eat the next day after you've cooked it, is actually lower and will digest slower. But that being said, it's not. I'm not saying that we should, like, you can't eat white rice. I think if somebody has diabetes, or even the Asian, South Asians, like Indian population, they are much more prone to pre-diabetes, diabetes, heart disease, all of these things. So we need to sometimes be more strict about these things, because smaller amounts of these things can lead to us ending up with diabetes. So I think it needs to be individualized. Nothing wrong with if it's coming with a lot of fiber rich foods with it, like if a person's eating a little rice and a lot of beans or something, maybe it's not that big a deal.
Thank you. Based on the evidence that you're aware of, can you be more specific about the time restriction of eating? Like, for example, how many hours should you wait between dinner and breakfast?
So most of the studies look at like 16, 8 or 12. So it would be like eating within an 8 to 12 hour window and then having the rest of the time off. But the most important thing is that not to do it in such a way that you get so hungry by the time you're eating your next meal that you're like, whatever I can get my hands on, I'm going to eat, and then you eat more unhealthy because you're so hungry. That is not going to help, because diet quality is then worsening, and that's not helpful. You have to do it in a way that you can maintain diet quality as well as, so maybe something like eating between 8 in the morning to 8 at night, or 10 in the morning to 6 at night, or something like that, where you are eating between a window and then the rest of the night you're not. Yes.
One word, in small time, you did cover a lot about prevention.
Yes.
And with respect to treatment in the cancer, which I did, I'm a doctor.
Great.
Harvard did show the study that if you supplement lifestyle change, chemotherapy or any disease, it does a big difference in results.
Yeah.
And it included not only the diet, also exercise, yoga,
yeah,
meditation, tai chi. They did show a very good results of having somebody that did traditional chemotherapy, or they had an addition to chemo,
Yes.
these things were added and they show a remarkable result. What's your opinion about that?
I believe all of that, but I don't know. I don't know which study you're talking about, and I would have to look at it. I know, in the interest of time, I didn't show, but there's a study like in breast cancer, where they showed that people who changed their diet and exercised to a more plant-based diet actually had better response to the chemotherapy and were more likely to be in complete remission when they had the surgery to take out the tumor. So it is possible that, but the studies in the survivorship space and in the prevention space are more used to be done. Now there are many studies in the treatment happening. There's a study with skin cancer and checkpoint inhibitors showing that on immune therapies, when people eat high fiber diets, they respond better to immune therapies. So those studies are happening now, but they're fewer. And
one more thing. The many diets being Atkins diet, low carb diet, ketone diet, and they come and go, right? They show people so much that what happened that they're no more good, the effect is no more there, or the people give up.
They are like fad diets, I think, and you can see I talked about ketogenic diets. I would say Atkins, modified Atkins, ketogenic, low carb, they're all in the same bucket. The three main issues I have with it is one is that body composition, they might lose muscle. Two is that the cardiovascular disease risk, because it's a high fat diet, so they have high cholesterol and higher risk of heart attacks and things like that. And then three is they're not getting enough fiber, so they are actually on a low fiber, so the microbiome may not benefit the same ways.
Yeah, so I know that you mentioned that intermittent fasting is good.
Yeah.
I do follow that, and also I do follow every 15 days the Ekadashi fasting, which I don't eat at all. So I heard that it helps for cancer prevention. How far it is true?
So that's the data mostly is with fasting mimicking diets in cancer patients showing some benefits. The challenge is there aren't very robust studies looking at that to tell for sure, but I think it's more important than anything is diet quality over fasting.
And last question, one more question. So I heard that eating cheese, like fatty foods, will inhibit cancer.
Will inhibit cancer?
Yeah, like if you eat cheese.
I have a question similar to this. Hold it. I'll ask that question.
Okay.
Thank you.
I'm not aware of that data showing that, and those cheese are more like high fat foods and high saturated fat, which in general we want to avoid saturated fats.
Yes, come back here.
If within dairy, the one that has shown benefit is more fermented foods, but fermented foods can be dairy based or non-dairy based too.
Okay, so I have a question, and this question actually talks about how India contributed to plant-based growth. There are two doctors, Dr. Madhavan and Dr. Gopalan, at the National Institute of Health in India at Hyderabad. In 1967, they published a paper, Effect of Animal Protein on Cancer, and they exactly fed casein, which is the component of cheese. And these two doctors study when it was published. There was another doctor called Dr. Colin Campbell, who is a Cornell professor at the time. He was sent by the American government in Philippines to take care of malnutrition kids, and he was feeding them animal protein because he grew up on a farm eating meat 3 times a day. When he saw this paper, he blew out and wrote a letter to the editor that you guys are idiot, you don't know what you're doing, this is upside down data. The editor said, no, I double checked it, this is the correct data. He didn't believe that. He went back to Cornell, redid the study, and it changed him completely, so much so that he went in Chow Lai, started a study called China study. He went there. There were 600,000 volunteers who took blood sample and food sample. So my question is, why we are not saying that dairy is bad because dairy promoted cancer among those mice? Those mice who were fed, so I'll tell you about the study. Those mice who were fed the animal protein, meaning dairy casein, they all died within 2 years. And the same set of mice who were given soya protein, they survived even after 2 years. So we don't talk about much dairy.
Yeah.
Some reason in Indian community is considered taboo.
Yeah. So I think I agree with all of that, that I think that basically fermented foods have the benefit, but they can be dairy or non-dairy, and it will be better to have non-dairy fermented foods. In terms of cancer risk, with prostate cancer, there's a significant association of dairy and cancer risk, very clear. With breast cancer, it's a little more mixed. With colorectal cancer, it seems to be the opposite, but it's thought to be because of calcium intake, not really specifically dairy, but more the calcium intake. So that can come from other foods as well.
Thanks.
Dr. Vasil, please introduce yourself.
I'm Tarun Vasil, and I have known Urvi for a few years, and I have sent several patients of smoldering myeloma to her, and that's how I actually got interested in studying some of the lifestyles. She was one of the inspirations, and most of the patients say that the diet is delicious. I wanted some patient to give it to me, but they said they didn't want to share. So passing point, actually, I think there is a lot of controversy in the field. I have a book which just came out about 8 weeks ago, and it has almost 4 or 5 pages on casein and Dr. Colin Campbell and Dr. Madhwan's original observation. And basically, I think the studies we know that the mice are different than humans to some extent, at least. So whatever is in mice may not pan out in the humans. You can see that in India, we are brought up on milk. We used to drink so much milk, but it was fresh milk. Maybe it's the currently available milk, which and how the animals are being raised, that could be one of the problems. But again, mice data cannot be translated. I don't want to belabor it anymore because it's already time is.
Thank you, Dr. Vasil.